Hello everyone, my name is Nina Ruzzo-Iacono, and I will be presenting on Lyme disease and the use of digital PCR as a diagnostic assay. In the United States, Lyme disease is often caused by the bacterium Borrelia burgdorferi. It is transmitted to humans through the bite of an infected tick, most often the blackleg tick. Symptoms can begin as a fever, muscle or joint pain, fatigue, and swollen lymph nodes, but can vary between patients and are often misdiagnosed as another condition. In some clinical cases, an erythema migrans rash can develop. It does typically give a bullseye appearance, but takes several days to form. Treatment for Lyme disease is usually a full dose of antibiotics such as doxycycline. On average, the treatment dose can last 10 to 14 days, but in some cases, it can be prescribed up to 4 weeks. Currently, serological two-tier testing is available to detect the antibody presence. A screening is done by ELISA and confirmation by Western blot. However, due to a delay in antibody production, false negatives are common. For this project, I researched a study that was performed in 2020, which sought to develop a molecular assay that could detect for Borrelia burgdorferi genes in the blood of Lyme disease patients by digital PCR. This study was a cohort study which analyzed the blood of 46 clinically diagnosed Lyme disease patients. All patients had resided in Connecticut, which during the time of collection, which was from 2016 to 2018, was considered an endemic area. The case patients in this study were those who had been clinically diagnosed with Lyme disease, and the control patients were patients who had no presenting symptoms of Lyme disease, no previous diagnosis, hadn't been treated for Lyme disease, etc. Digital PCR is a quantitative PCR method that sensitively and reproducibly measures the amount of DNA or RNA present in a sample. Samples are partitioned into individual wells, and each well receives one of the target genes or no gene at all prior to undergoing PCR amplification. By partitioning into individual wells, it increases the sensitivity of the assay. It uses Poisson statistics to count the number of positive reactions versus the number of negative reactions in order to quantify the target. In order to determine which sample type was ideal for the identification of the target genes, a pre-analytical processing of the blood samples occurred in order to obtain serum, plasma, platelet-rich plasma, and whole blood. DNA extraction did occur on all the sample types. Bioinformatics was used in order to identify a unique Borrelia burgdorferi gene sequence to be used in the TaqMan assays, and Borrelia burgdorferi strain 31 was the source sequence chosen for each of the 4 genes. A pre-amplification step was done in order to enrich the DNA extracted, and molecular detection of the genes was done by digital PCR and qualitative PCR. Digital PCR was performed on a Biomark platform, and qualitative PCR was performed on a QuantStudio 7-Flex real-time system. Both PCR methods did have varying levels of CT values that would indicate a positive result and a sigmoid amplification curve. The results for the specificity and sensitivity of Borrelia burgdorferi specific TaqMan assays did show that 100% of the time it was consistent in its ability to detect 3 genome copies of Borrelia burgdorferi in all 4 of the genes. There was some variations in the positive and negative replicates in each panel, and they concluded that these variations were likely due to the qualitative nature of the assay, but since they were basing this study on its ability to detect the 4 genes, they were less concerned about the variation that they observed. The results for the pre-analytical processing of the blood samples determined that platelet-rich plasma had the best sensitivity in detecting all 4 of the genes, but the detection rate was still quite low at 19.05. Of the 21 patients, only 4 of them showed a significant CT value for one of the genes. They figured that this low detection rate could be due to variations in storage and the pre-analytical process, and that actually these 2 things can have quite some significant effects on the detection rates. And as shown in this figure, this is a heat map of each sample type for one of the patients that had been clinically diagnosed with Lyme disease. To evaluate the clinical samples by digital PCR, they compared analysis on the 2016 samples to the analysis on the 2018 samples. For those 2016 samples, a quarter of the DNA extracted from the platelet-rich plasma sample was analyzed by digital PCR. It was determined that 7 of the 11 patients did have Borrelia DNA in them at either the initial or 2-week visit. And for the 2018 samples, which in contrast, they ended up using all of the DNA extracted from that platelet-rich plasma, 10 of the 14 patients were positive for at least one of the genes at the initial visit, but all of the patients were positive for at least one of those genes during the 2-week and 6-week visits. So this showed that the sensitivity of the assay significantly increased by including all 4 of the genes. And when you compare it to the 2-tiered testing, the 2018 samples, only 2 of the 14 patients had been confirmed by Western blot during that initial visit. And when you take 2016 and 2018 patients together, the data sensitivity of digital PCR significantly increased in comparison to classical testing. Classical testing, that 2-tier testing, was a 24.35% positivity rate, and digital PCR had a positivity rate of 58.54% during the initial visit alone. The overall goal of this study was to design a molecular assay that contained a panel of 4 gene-specific targets that could detect the most common causal agent of Lyme disease in the United States. The assay utilized primer and probe sequences, and these sequences corresponded to the sequences within the species. The study was cohort-based and included patients that were in an initial stage of infection, that were on antibiotic treatment, or those who were in recovery. The goal of taking patients from each sample group was to increase the sensitivity. Platelet-rich plasma samples did prove to have the best detection rates for Borrelia burgdorferi genes, and they concluded that this could be because the plasma samples eliminated PCR inhibitors, and also that the spirochetes could co-migrate to the platelet-rich plasma. In comparing the digital PCR testing to the 2-tier testing, it showed that digital PCR was at least 2 times more effective in diagnosing Lyme disease. And digital PCR also had a much higher sensitivity, and they figured that this was probably due to the inclusion of 4 Borrelia burgdorferi specific genes within the assay. This study can be extremely beneficial to the future of Lyme disease diagnosis and treatment because right now we lack a method that is highly sensitive and specific to detect Lyme disease during that initial infection period. The current CDC-approved 2-tiered testing method has a very low sensitivity because of the body's delayed response in producing those antibodies during the first couple weeks of infection, and also because everybody's immune system responds differently. This digital PCR method did show to be improved, and because the researchers took additional steps such as pre-analytical processing of the blood, pre-amplification, they were able to account for the loss of sensitivity due to low numbers of spirochetes being present in the patient's bloodstream in that initial infection period. That concludes my presentation. Thank you to everyone for watching, and I hope you were able to take some new information from it.